I'm having a very interesting guest today. We are talking all things back injury, back pain. We're talking with a man who has been specializing in this for so many years, Andrew Locke, all about how to rehab back injury, whether we can reverse and get rid of the pain. We'll see what we get from him. Such an amazing professional, and we need to get him on. And I've got him here. Hello.
Live and dangerous. Astrid, how are you doing?
I'm so happy to see you.
Most wonderful. Yes, the Instagram live experience, huh? What a glorious thing. Well, we certainly look forward to helping everyone find some interesting answers to questions, huh?
It is going to be great, and I've got quite a few questions in a format that I try to make it really interactive, and because science, physiotherapy, fitness, nutrition is all so nuanced and it all depends, it is always good to sort of ask questions that might just trigger you to take a stance and really sort of look for navigating why your answer is what you are responding. So I am looking so much forward to having a chat with you. So you ready?
Absolutely. I love the words you used. It depends. Let's find out. What do those questions mean, huh? So, yes.
All right.
Go
so the first one, just getting to know you a little bit, because I know you have an amazing background, but I really wonder why did you choose to be a physiotherapist in the first place? Why the spine? Why low back? Why do you do what you do?
Well, remember, Astrid, I think one of the great things in life is I always say that if you do the thing that you have passion about, that you never actually really work it daily in your life. And that's exactly it. I played a lot of sports as a kid and always have. So one of the things about that really was, as a young, say, baseball player, cricket player, I was often seeing a physio for whatever was happening because I was often playing really 7 days a week. And I thought, that's an interesting profession. I like that one. But I really had intended to be a professional sports athlete. I was going to play baseball in America, and that was my big plan. I played for Australia in the Junior World Series. But about that time, I discovered a bit of weight training, and weight training suddenly took over. Found a new passion in life. And I thought, I was actually even thinking of becoming a professional wrestler like the WWE. So I got scouted to do that as well. Very close, but I decided a bit of a safety net. Perhaps I should study as well, just in case something happens. And sure enough, I got injured fairly significantly, and I continued on with the physiotherapy journey. Now, I definitely, although I'm called a physiotherapist, I don't really like to refer to myself as a physio. I say I'm a health professional. One of the best pieces of advice I tell anybody, whether you're a physio, chiro, osteo, myo, is that you need to lose your religion. You need to stop being just that. You have to open your eyes and look around at all the other professions and what they can possibly give to us. So I consider myself more a movement scientist, and it's a journey that continues every day. So that's pretty much how I got here.
That is so amazing. I love that you're saying to leave that religion, just be someone who people know for what you do, and you're helping people, that the professionalism you work with, trying to work with that. I don't know, the word I'm trying to look for is like really paying attention to being honest and getting as much out there as possible, being very true about yourself and what you do and why you do what you do.
It's a very human experience. And I think that's why we do what we do. I think this is our community. We're people who like to lift weights. We're people who like to run. We're people who like to move. And we associate with other people who eat well, train well. There's a lot of congruence in that industry for what we all have a passion for. So for many of us, it really is that thing where you're just becoming part of a community. And that's why it's so beautiful to leave behind the label, I'm a this, I'm a that. You're a member of a very large community of people, and we're all working towards the goal of being the best we can be and to help others. And that never stops.
You mentioned something that is very interesting, that you got injured. And do you think it was that something that led you to be more inclined to do physiotherapy instead of something else?
Oh, yes. It was Probably within the sport of baseball, for example, I would often get shoulder and elbow injuries, which is very common with it being a pitcher. And then as I was looking to get bigger and become a professional wrestler, I did a fantastic job on exploding one of my discs in the most spectacular fashion that took 2 years to actually recover from. Now, that's a beautiful insight for me because I've experienced some of the worst injury and never had a problem ever again after that. So I could look at well over 20 years of never having another problem, but it took 2 years to manage and be successful. Mainly because the only option that was offered at that time was a spinal fusion. And I didn't really feel I had time to have downtime, young professional. So I experienced the what it's like for a really impeded life, but still never stopped with the goals. I could still bench press. I just couldn't squat and deadlift. And so you really get a lot of insights. And now, of course, no problems ever since, but that's because I pay attention to the details now. There are things I do today that I have been doing for over 20 years every single day because I never want to have a problem again. And that's why I instill in my clients, when I give you exercises to do, it's not till the problem's gone. This is for the rest of your life. And after that, we can negotiate. So that's pretty much where it goes. We change.
Sounds like a good trade. Now, when we think about low back injury or like a spine injury, how do we define it? Because there is so much nuance in that term. Oh, well, low back injury. Well, what do you mean? So how do we define that to begin with?
Injury comes under a really basic, beautiful biological concept, is that every biological tissue that exists has load or fatigue capacity, such as my finger. I can bend it back. It can take that load and that capacity, but further than that, and I'll snap the ligament at some point. That's the injury process, is where you overload something beyond its capacity. Now, let's not talk pain at that point. We're just talking the biological relationship of creation of injury. The perception of pain is a whole different world. Now, there's a lot of that within what's being taught at academia at the moment. It's taken me over 20 years to become exceptionally competent at excellent movement analysis. Forget the behavior part. I've been dealing with that for over, I think every human reaction we have into a relationship we have is a relationship of biopsychosocial. But we're supposed to be the professionals who have understanding of physical movement. We're supposed to be the professionals, physical therapists, there's the word. So the biological injury assessment is something you won't know by the time you finish university. I had to do over 120 contact hours, I think it was, with the Mcgill Spinal Institute, then sit 2 practical and written exams, just to be competent in that method. So if someone says, oh, I used the Mcgill method, you better have done at least 120 hours and passed your exams before you say you know the Mcgill method. That's what I talk about. Professor Mcgill. People say, I used the Mcgill method. Really? Well, I'm not even qualified in the Mcgill method. I've met him. I've spent time with the great man. I've even spent time at his house in Canada. I know a lot about it. I've been lectured by him. Am I a Mcgill professional? Absolutely not. I haven't passed the exams. To become competent at anything, you've got to jump over the hurdle. You've got to have done the work to the level that is expected by those examiners. So when someone says, I got a back injury and I'm going to go see a professional, well, hopefully those professionals have spent a lot of time doing postgraduate work. It's not something you graduate knowing how to do competently. I always say when you finish university, you are now allowed to start learning. You've just been given the tools to learn with, and get ready. It's never going to end. I love it. Every day a patient will come in with something. I'll do something different with a patient every single day who will come in that I may have never done with 100,000 other patients. Everyone's different. But to be able to assess and know what that difference is, to make that difference to that client, is what comes with skill and realistically time in the practice. I
agree. And I love that you mentioned quite a few things I want to ask you about. This one is, you mentioned the Mcgill method, and I've heard that this is a very, very well-known method within the physiotherapy world, but I have no idea what it is. So can you tell us a little bit about that method, and then we move on to other questions I had, so I don't confuse you.
Well, the beauty about any true method is you must study the method, you must pass the exams to say you know what the method is. Now, perhaps I think it was 1996, it might have been when I read my first research paper by Professor Mcgill. Consider this, he's published over 350 peer-reviewed top-level papers, and he's been cited over 21,000 times in research. This is a guy who knows spines. Now, the Mcgill method is a method of assessment. And then, once you have the correct assessment, You then apply the interventions to that assessment. Now, that's a lot of work to do to be able to be competent to know how to do that. Now, Professor Mcgill is that good that if he examines a person, he can easily tell you biologically what the injury is going to look like. He's had surgeons who can't believe that he actually knows which way the nerve was in a particular surgery by prediction before it even went in. Now, these are things we can do anatomically. We can predict an underhook or an overhook of a nerve. We can say which direction we believe a bulge will be. But hey, guess what? You've got to know how to assess to be able to make that call. And that takes years and years of practice and doing the study. So although people might say they know the Mcgill method, I bet 99% of them don't know the Mcgill method. They might have, if they're lucky, they might have read his book. Hey, I've read the books 20 times. I'm not a Mcgill professional yet. So anyone who says like Mackenzie, I bent back, I did a Mackenzie extension. No, that's not a Mackenzie extension. I met Robin Mackenzie well before he died. Mackenzie's a philosophy. It's an understanding and a diagnosis of movement. Extension was just one of the things that was used. We used flexion, we used off-centered movements. So I was qualified in the Mackenzie method as well. So the thing about it is, to be able to say, you know the Mcgill method, you really need to have passed the exams. To know the Mackenzie method, you better pass the exams. To have read a book, you don't know the method, but you've got an introduction to understanding the methods. Okay. And that's why I say we need, as professionals, stop being a physio, stop being a chiro, stop being an osteo. Let's become movement professionals and all work together, because I've learned some of the best things from chiropractors. I've learned awesome things from osteopaths that helped me perhaps more than even my physio undergrad.
Awesome. There's another follow-up questions I had about the biopsychosocial model of pain. And I think it is very interesting to understand that, to sort of look at the big picture when we are understanding pain and why the pain and how this is sort of all coming together. So what is that method, or this model that you usually refer to as a biopsychosocial model of pain?
I call it the biopsychosocial method of life. When you were in kindergarten, you had a biopsychosocial interaction with your friends. You ordered your lunch from the tuck shop in a biopsychosocial method. You interact with your humans. Everything in life is biopsychosocial. Someone seems to have thought this is a new discovery. No, you've been doing it all your life. Your parents did it all your life. Everyone's been doing it forever. It's called living. Now, we're supposed to be movement professionals. We're not psychologists. If you want to go do a psychology degree, good news, go do it. But I think as movement professionals, you better learn your expertise, because if someone comes to see a physical therapist, they're expecting someone competent at assessing that component of the biopsychosocial life. Every interaction you ever have with a human being, if you're good at it, you start to understand. It doesn't matter whether you're trading with a stockbroker. It doesn't matter whether you're talking to the pharmacist, talking to the local butcher. Everything is a social experience, and some people have good days and bad days, and some of us are really good at picking up on those things. That's life. So, if a client comes in with me and they've had a bad day, well, you know what? We can allay that before we get into the assessment component. But they're there to see me more for that than anything else. So I think as human beings, and especially the ones in what we do, you're supposed to be pretty good at being a very empathetic individual anyway. So we love our clients. And that's why we do what we do. That's why I say I've never worked a day in my life. Hell, I'm just so happy to see people. And I enjoy really helping where I can, doing what I can to help people.
So when we're diagnosing pain or a specific injury, do you think it is not just perhaps that specific issue in the body that happened? Let's say we're talking about low back pain, and it is related to the sciatic nerve or something like that. But there is more than that. Perhaps it's like you're also stressed. You're sleeping you're not sleeping well. You have this and that, and like there's so many things around that it may aggravate your mental state, and that could increase the pain or the perception of the pain. How does that work?
That's beautiful, and that's what I talk about. It doesn't matter whether you see the butcher, the pharmacist, or you see your local doctor, and you hear that quite often, is that the first thing that will happen when I tend to a client will walk in, I will ask them pretty much, what is your goal? What have I got to help you achieve? Now, I don't ask them what their diagnosis is if they bring in a whole bunch of MRIs. I don't ask them what somebody else has told them is wrong with them. No, I want to know what your goals are. I want to know what you want to achieve in your life, and what have I got to do to get you there? Now, that's a biopsychosocial introduction. I haven't started with a physical assessment. I've started with, hey, you're a human being and you've got a problem and you come to me to solve it. What is that? Now, then that allows me to see it in the framework of what their stresses are. So there can be other stresses that come into it, but we're already started to talk about those things. You know, you've got kids. Your problem is you've got a 5-year-old and you want to be able to chase that kid wherever they go. We want to pick them up when they fall down. All right, I understand. You've got a family life now. Good. Now I know where I can help to emphasize my work. Or you're a professional athlete. You've got a contract and you don't want, your team doesn't want to know that you got an injury. How can I help you get through that? What do we do? Everything's a life relationship. And that's where I think the human relationship, what we do. Then we start to look at the biological movement patterns that have given you a problem, and we solve those in the framework of reaching your life goals.
Okay. Do you think it is possible to, like, based on what you mentioned, it is, but is it possible to totally reverse or cure a back injury, just getting it back to normal? Or do you reckon there's always higher chances to sort of relapsing or having it again?
Not if you see me, you won't. All right, the basic thing is, let us look at things from a different perspective. Let us start to look at what is the gift that the injury has now given you. For example, what have you been doing wrong that actually would have impeded your ability to get to where you wanted to in your life or your goals? That injury has occurred, most likely, due to something you have done poorly or consistently poorly or not understood. Great, here's an opportunity for you now to be better. So an injury, less than a negative, it can often be a spectacular positive because it now allows you to reach your goals with a more specific understanding of perhaps what you were not evaluating. Do I need to biologically heal for example, a disc injury? Well, disc injuries, like anything else, do heal. But realistically, if we don't understand the cascade behind them, they don't really return back to their original form. But is that ever necessary? Well, pretty much not. I've got some fantastic people who have had severe disc injuries whose discs by now have basically, we shall use the word as poorly, I don't like it, which is degenerated, it's changed. But they are people who can lift 300 kilos, and that's their goals, and they have no problems in life. Now, it wasn't the injury that defines them, it's the fact they learned how to become stronger and better at what they do. They adapt if I teach them how to understand what it was the problem that they originally had that caused the injury. The Gift of Injury is a very good book that Professor Mcgill wrote with a guy called Brian Carroll. Understanding Brian Carroll has squatted more weight, I think it's 1,306 pounds, after having one of the most spectacular debilitating injuries. All right, there was a gift under there, and Brian would certainly say it's a gift. So let us see positive from an injury that will take you closer to your goals.
I 100% agree with that. It is such a powerful, like, discovering that you have an injury, but coming back stronger and knowing how to do what you need to do better, and not necessarily like, oh, I have an injury, I'm fucked. I'm not going to be able to be back to normal again. And I think it is a really huge thing that doctors nowadays sort of kind of give you that fear, like, oh, well, you know, you've got an injury, you have to quit exercising, you have to stop lifting because you are now crippled. I don't know. It is just the way, the wording they use, and the sort of the method is like, well, you will probably need to have surgery if you want to get back to life. And it's like, I don't want to.
And surgery is not a dirty word if we know the right thing. You know, every few months I'll get a patient, they've made me by video because I do a lot of consulting by video, and I might look at a client, see them move, hear the history and say, you need surgery. That'll be your best outcome. You'll get the goals that you want in life faster by doing that than if you wait conservatively. It's an evaluation. If you're prepared to wait longer, you still may resolve. But after the opinion you're after, which is what's the best thing to do, I would advocate a very quick, easy surgery and your problem will be resolved. And it's happened quite often. I've seen a patient on a Friday night who has come in, and I looked at them and said, if you're not better by Saturday, I know the best hospital where I want you to go. You can go see, I know the spinal surgeon who's on there. And normally it would take 3 months to get in, but because he's on call, I know that he would see. And you better be a little bit better on tomorrow morning. Monday morning, I walk up into the practice and the guy was standing there. I said, oh, how's your weekend? He goes, I had surgery on Saturday. Now I'm seeing you. That's a sort of outcome. If you know what you're doing, it's not a dirty word. But once again, I always say you've got to know your surgeons, you've got to know your professionals you're dealing with, not just anybody. So it is an evaluation of, I think, a network of good professionals as well, that we are all aiming for the outcome of our clients' goals.
Sounds good. Now, do you have any advice or strategies to deal or navigate training when you have low back pain?
I've probably never told anybody to not do something, as in to totally rest. There are certain times in the early stages where I don't deal a lot in acute anymore because I've got a 6 to 8 week waiting list to see me. So if you hurt yourself today, you wouldn't be able to see me for 6 to 8 weeks, which realistically means most problems are solved by then as far as the injury pain mechanism. But if you've had recurrent problems or you've had long-term problems, that's where I tend to step in. So if we have a look at the effect of having an injury in the early stage, we're still looking to see how do we reduce that impact from day one. So there may be regression exercises, there may be glute exercises, there may be abdominal exercises, there may be things that, hey, you might not be squatting or deadlifting that day, but we may need to improve your brace and the fact you've got poor hip extension, and we can do that without making you feel any pain. So we always say that if you have a car with a flat tire and you park it out the front of your house on the night and you get up in the morning, guess what? The tire's still flat. So rest didn't do a darn thing. Rest changes pretty much nothing under most circumstances. We're going to try and get you and keep you moving from the first chance we'll get. I can't remember a single patient I've ever said, no, you can't do anything.
Yeah, okay. So it probably means like, because we think about like acute injury, perhaps like if you do something at this stage and very acute may aggravate the pain or may aggravate things. So if you injure yourself today, should you wait a little bit, let's say, just to get a slightly like reduce inflammation, just get the things slightly more settled, and then start doing something when the pain is slightly lower? What should you do? I don't know.
The challenge there is actually to see somebody who can direct you to do the thing you should do, because you might think, perhaps if I move in this direction, I might move better, or I might be better. It may be the right direction, but how do you know? How does a physio know who's just graduated? Probably hasn't. You know, it's a skill to know what it is, what direction you need to have. It's a very specific thing. Do you go backwards? Do you go forwards? Do you go sideways? What's the thing you're going to do? Well, I wouldn't leave it to instinct. I have to leave that one to education. And as we say, that's when it becomes the case of it depends. And I know a lot of good acute professionals who will be able to assist in that. That's why I think the McKenzie method was very good in that. The McKenzie method for the acute stage, I think, is outstanding.
I have another question for you. And what is the most common injury you see often in your practice? Well,
2 things. Shoulder pain from bench pressing and low back pain from probably poor deadlifting technique.
Okay.
They both technique though.
Okay, and both comes down to improve when you change the technique.
Well, you understand pain once again is an opportunity to become better. Find out what you are failing at. What is the thing you have not addressed? So in shoulder pain, it generally is control of the shoulder blades. And that's really putting it down. Where's the most common source of pain problems with bench pressing? Lack of ability to control the shoulder blades in most people. So it's bench pressing is a skill.
Okay.
And with deadlift, yeah, you can get away with poor technique for a while, but not for long, not forever. There's a fairly famous coach I know who was very proud of the fact that he deadlifted 300 kilos when he was 19. Fact is, the guy's over 40 now, and you know what his best deadlift is? Never got better than that 300 kilos. Because his ego is so strong, saying, but I used this technique to get 300 kilos. Yes, but it was a shit technique. That's why you got injured, and you're still banging away with that poor technique over 20-something years later. Now, what sort of coach do you have who takes a 19-year-old who achieved a 300-kilo deadlift and turns him into a 41-year-old who still has never done more than 300? That's a bad coach.
Yeah.
So you get away with poor technique for a while because tissues have a capacity. Exceed that capacity, then you got a problem. All right.
I agree.
Now we're going to use the opportunity to make you better and take you past that 300 kilo.
And when it comes to training effectively, what are some of the best cues? Maybe we talk about internal or external cues you've used with your clients to improve a movement pattern. So what are those, like, you think, well, these ones really, really are helpful to improve the deadlift position when you take in the bar, or when you're doing a back squat, what sort of cues do you think are very helpful when you work with your clients?
It's actually interesting. I always talk to my clients really usually before we start working, and I say, if I'm not saying anything, then you are doing it right, and I don't need to say anything. So my expertise especially comes from under cueing. I say as little as possible, because one of the big things I think our community is a pretty smart community, and there's a problem with smart people. They think too much. So a client will say, like what happened yesterday, do you want me to? And I said, did I tell you to? And they go, no. Good, then I didn't want you to. And I always say, that's my introduction to it, is, if I didn't tell you to, I don't want you to.
Okay.
So I really try, and because we've got people whose brains work so hard and they think so much and they're smart, I got to say, I'm not going to input more on top of that unless I need to. And I'm going to give you a simple cue. So with bench press, our cueing after learning the exercises that you will feel will tend to be, let's pull that shoulder blade down and back. Shall we say shoulder blade to back pocket? That's it. Shoulder blade to back pocket. 5 words. Okay, that's all I want you to concentrate on. Now, that cue will probably give you the stability once I've given you the exercises that start to make you feel that stability. And say with deadlift. Well, an external cue I sometimes like to use is realize how stable you are. You're standing on a freaking huge planet. You're not going to fall off the planet. You're standing on that planet, your feet, you're like an ant. You look horizon to horizon. You're incredibly stable. All right. Now, what I've just started to do is I start to make the person think of stability. Unconsciously, they suddenly feel, hey, this is, instead of saying, I'm on these 2 little feet and I'm about to lift a big weight, suddenly going, no, you've got a big planet. And you're going to leg press that planet away. Well, suddenly it changes. That's an external cueing, and it works beautifully for a lot of patients. So we sometimes use some beautiful cues that sometimes are the opposite to the way people have been thinking. External cues, internal cues, rather than saying, I never say contract a muscle. This is one of the biggest things I will always say as a professional. Don't tell anybody to tense their glutes. I'll say, maybe push your knees out, push your hip back, push your foot to the floor, push through your heel. I'm going to give them cues, because most patients, you tell them tighten your lats, they don't even know where the lats insert and where they originate. How will they know where the lat is? You're assuming that they know as much anatomy as you do. And so what we'll tend to do will be shoulder blade to back pocket. All right, that's actually me getting your lats tight. So I tend never to use a cue that uses the muscle's name, because most clients will misunderstand what that muscle is and what it feels like. But if I say pull your knees out when you squat, what muscle is going to pull your knee outwards, push your knees out? Well, that's abduction and external rotation of the hip. That's your glutes. So I've actually got you doing, oh, I know how to push my knees out. Good, yeah, I didn't tell you to contract your glutes, but they just did it. And that's the skill of helping your client stopping to overthink.
That is so amazing. What do you think about sort of some cues for hip thrusts, or when you're working, that improving that technique when you're doing a deadlift or good morning? When it comes to like pulling, like rather than pulling the bar, you're actually getting your body pushing away the floor, but also like your kind of back and glutes are sort of moving backwards rather than feeling like you have to pull the bar. I don't know if you understand what I'm trying to say.
Yes, and we often say it about the deadlift. It's rather thinking of the push than the pull as a movement, and that's a cue that works for the right person who needed to connect to the ground better. So yeah, there is no one cue that suits absolutely everybody.
Yep.
And that's our ability to be comfortable with looking at the individual and saying, yeah, I'm not going to use that because that's something that's not going to work. I'm going to use something, and it's quite often, I would always say every single day I will do something I've never done with somebody else, because everyone's the individual. But everyone gives you a reference point for the next person who walks in. So you get a little bit better at being able to pick up the tiny things that make a big difference. And often that's really it. Like getting someone to perform a front plank perfectly. Everyone pretty much will do it incorrectly unless you take them through the step-by-step understanding of how we brace before we actually go into a plank. Simple things, beautiful cues. So every exercise has nuances, and the more you work with people, the more you realize that there is no one cue that's going to be always applied.
Perfect. Yep. Now let's move to a really cool part that I enjoy a lot, that is overrated and underrated, all things injury, and back pain. So I'm going to state or make a statement, and you will say, well, this is overrated or underrated, and sort of give your why you're saying that. And you can just be in the middle, properly rated, or maybe it depends. So let's go with the first one. The number one, the importance of glute training beyond aesthetics. Is glute training for health, posture, injury prevention, and rehabilitation? Do you think is that overrated or underrated?
Oh, spectacularly underrated. We are hunter-gatherers in a technological society. So we've taken at least 400,000 years as Homo sapiens, that's as Homo sapiens, as hunter-gatherers, and here we are, creatures that are supposed to be walking, running, jumping, climbing trees, and we sit on our asses from the moment we get up in the morning until the moment we go to bed, pretty much. We're in a 90-degree hip flexion position. Your glutes function best at a straight line, which is shoulder, hip, knee, which is the walking stance position. So here's a big muscle that has evolved to propel you forwards, and you're sitting on it in 90 degrees of hip flexion. 90 degrees of hip flexion is where your hamstrings and your adductors have an advantage in extending your hip, not your glutes. So we've basically not evolved to live in a technological society. As a result, glute training work is an imperative. Underrated, massively. One of the failures I've seen in research, and it was amusing, was saying glute activation didn't make a difference. Well, one of the studies I saw in it was very amusing. So they looked at people who are on their feet a bit more often and some who are sitting more often in their days. And then they examined whether those glutes were more active or inactive. Yeah, what the problem was is each group was given 5 minutes of walking prior to the test. Walking is glute activation. Fantastic. You've just done an intervention in the methods, which is going to invalidate your results. 5 minutes of walking. Great. You've just done 5 minutes of hip extension. Of course, everyone came out the same. And that's a bit of a problem with research. If you have researchers who don't understand what they're doing, which to me, that was straightforward. Great. You've just activated for 5 minutes. Of course, you're going to change the outcome. Big problem with research is how many people actually really understand the methods and the assessments and the interventions before the results. I saw one on shoulders that said shoulder activation didn't work. Yeah, and it was quoted quite widely. What was a shoulder activation? Twice a week with a physio and a TheraBand. Shit, my clients do it twice a day. That's 14 times a week, and not with the damn TheraBand. Of course we get results. It's a lack of understanding of the interventions. So we get a lot of things put out as, hey, this is the results of the research. Give me 10 piles of shit and compare them all, and I'll tell you what, they're all piles of shit. You didn't get me good research. So it really depends. Good research is tough to find.
Yeah, I agree with that. Second question.
Yeah.
Low load activation, exercises with bands and body weight, targeting the glutes for rehab, like glute bridges, bird dogs, sideline clams, banded squats. Are they underrated or overrated?
Well and truly underrated still, which is nice, because we're still looking at a hunter-gatherer. We're looking at saying, as a human being, what do you need to be able to do more consistently? You need some glute work. Now, I find it absolutely hilarious that there are people out there that say bands don't work. And you're just going, your muscle does not know that it is a band. It's resistance. It doesn't know the difference between a barbell, a dumbbell, a kettlebell, and a band if there is resistance against it. It's simply resistance. The muscle contracts. So the amusing thing of people saying bands don't work, you just go, that's hilarious. Your muscle doesn't know it's a freaking band. It's, that's tough. I'm pushing against it. I'm abducting. Yeah, right. I'm extending. Yeah, good. So bands are really great as long as you know how to apply them and for what the outcome purpose is.
Yeah, it's not like the fit chick that comes into the gym and they use the band for everything and they walk with the band and then they sit with the band and then they do a Stairmaster with the band and kicking back.
That's a little bit obsessive, isn't it?
Yeah.
So
now,
low load, high frequency teaches skill. And then we put that skill into the required pattern. So if we're doing abduction, external rotation with a band at 90 degrees, that's good. That's going to then translate to your squat. Great, you've just taught the pattern. Motor control learning, it's about learning patterns. So you're teaching control. There's no one in the world who says a good musician never practiced. There's no golfer in there on the pro tour who doesn't practice putting every day, driving every day perhaps. So if we're performance athletes, we practice the little things to make our big things better. And that's low load, high frequency. You better be doing it every day.
That's good. I agree with that. Third question, autoregulation. Overrated or underrated?
That's one you can sit in the middle. Depends on the context. I love the word, it depends.
Okay. Using bands and glute bands for rehab overall?
They're part of the tool. In other words, I would say
Properly?
even my best athletes who may squat 400 kilos will warm up with the band. Some of them may even put 400 still around, but put the band around on 400 kilos. It's the application of the tool. Not relying on the tool, it's using the tool to achieve an outcome.
Okay. So would you say properly rated?
Oh, in the hands of the right professional with exactly the right reason, outstanding.
Okay. What about training heavy for injury prevention? Is that underrated or overrated?
It's beautiful. It's a wonderful thing to do. Everything from the lightest weight to the heaviest weight you move should be done with as perfect a technique as you can achieve. Yes, at the very, very limits of competition, you will be allowed at some point probably to find where you do have a flaw. But if 99.99% of your training is as excellent as can be, then your capacity to endure a flaw at maximum effort, quite okay. If you just practice crap technique all the way along, and then you just load more on that crap technique, welcome to injury. So like anything, could you imagine any sport in the world, Olympic lifting, gymnastics, where somebody says, don't worry, do shit technique, you'll figure it out? What? No, absolutely not. That's why the best coaches in the world are employed by the best teams. Yeah, they pay a lot for good coaching. Olympic teams. Yeah, because we're technically excellent. So yeah, if anyone says, yeah, you're adapted to shit technique, no, you just get shit with shit technique. There's no world-class athletes that consistently don't pay attention to technique.
I agree. Now, one that you probably will enjoy speaking about, Pilates.
Pilates, no one even knows what it means, because he died in the year about 1960, Joseph Pilates, and as a result of that, people tried to trademark the name Pilates, obviously to try and make some money. After he died in the year 2000, the US Supreme Court determined that no one could actually define what Pilates was. As a result, there is no international Pilates board that has any power, so you can walk your dog and call it Pilates. You can go swimming and call it swimming Pilates. There's no definition of Pilates that is actually standardized. So when someone says to me they do Pilates, it doesn't mean anything. It's someone's interpretation of some movements that may or may not even relate to the original movements that we were ever given. It's an unfortunate thing. Perhaps they might say, I use the reformer. Good, let's say you use the reformer.
Okay, so do you reckon, is that completely overrated or underrated?
Whatever it means. I always say, if you're not going to do anything, but you're going to do something and you call it Pilates, well, I'm happy you're moving. Good. You've got to let people do the thing they're going to do, not tell them to do something they're not going to do. There may be something with of greater benefit, but if they're not going to do it, welcome to the psychosocial world. You're not going to get them benefit if they're not going to do it. But I want them to
agree, 100%.
Yep.
Planks.
Planks. Done correctly.
Overrated or underrated?
Underrated, but underperformed. Well performed, poorly performed. To do a perfect plank, which is actually on my Instagram page, have a look at how it's performed. Shant, who demonstrates it in the method that Mcgill taught him. You do a plank that method, you know you're doing a plank. We're not doing these 10-minute, 10-hour planks. No, we're setting up a particular brace for a particular purpose that we're going to apply to movement. I'm going to teach you how to apply that feeling to your next movement.
That makes much more sense.
Yeah. Every exercise, there's no such thing as a bad exercise. There's just a great exercise poorly performed at the wrong time for the wrong person.
Great set. Okay. Another question is mind-muscle connection. Is that underrated or overrated?
I think the very best, this comes from the joy of working with a lot of bodybuilders for a long time, is the best bodybuilders don't understand why you don't grow muscle, and they do. They connect better than anyone else. They get it. There is a mind-muscle experience that definitely occurs with, I think, the best people. That's why a lot of really great athletes sometimes don't translate to great coaches, because there's an innate within them experience which is very hard to transfer. I always find your better coaches tended to be people who struggled more. Look at me. Fuck, couldn't struggle more than this. Hell, how do I only get this big with 30 years of training? Shit, what a waste of time. But I've got a body image disorder, so I've got to keep feeding it. You know, you look at it, you go, it's a slow process. The rewards for most of us are slow. And then you meet the person with a year of training, suddenly does what took you 10. There are those things, Astrid, no doubt about it. It's the mind-muscle connection is a gift. And some of us get it. For example, me in baseball, I got it. I could throw a good fastball, I could hit the ball out of sight. Teaching the skill, no, actually, basically all I did was practice a hell of a lot.
Yeah. What about the most underrated exercise for overall functionality? What do you think would be one exercise that is really underrated, that you think people should be doing every day?
Realistically, the thing about squats is I think that is the most underrated exercise. I think squats, and you've got to respect hip joints, which is really super important. So not everyone can go arse to grass. There are people who cannot. There are people who cannot hit parallel, but there are those who can. So I think a squat movement essentially is one of the most important functional movements a human will do. Because if you ever had to work with old people in old people homes and stuff like that, you'll tend to find they fall into chairs. They've lost the ability to squat and move in old age. That's one of the biggest predictors of injury in old people is falling over, the inability to hold a good position. So teaching squats, I think, is the most beautiful thing.
Okay, so you think that is the one exercise people should be doing at least every day or every now and then?
Well done. Every day. I mean, we sit in the chair. We should just use that as a tool. Practice.
Excellent. Or going to the toilet.
You're going to sit, you're going to squat, so you may as well practice it, and practice it with good technique. Don't just fall into a chair. Don't just fall on the dunny. No. Push your hips back. Push your knees out. Feel what it's like to actually move in a good movement pattern. And I do that with my clients. It's always there. Practice your good movement patterns at every opportunity.
Amazing. Now, let's move to another category. So it's true or false, or yes or no.
Sounds good.
This one is a little bit trickier because obviously it depends, but let's see how it goes. So the first one is, if you have a back injury, you should stop training. True or false?
Totally false. Of course, there will be, stopping training is a huge thing. We want to be able to, as soon as you can walk, it's some form of training, weight bearing. So we really don't want to stop. We want to be able to move as early as we safely can. And so if you've had a bit of a longer term back problem, there's no reason you won't be doing bench press. You might have to modify it and put your feet up on the bench if you find it's intolerable. But there's ways of doing everything. So we can walk into the gym, we can modify pretty much anything to get our body in a position where we can do something against resistance. So I've never had anyone who said, no, you don't go to the gym. I'll just say, okay, you got your arms left. Okay, your legs are a bit of a problem at the moment, but we can do some upper body training. We can do some lat work. So yeah, always something to do. Okay.
Poor posture and weak glutes are the cause of low back pain. True or false?
I don't like the word pain. I would say they contribute quite often to injury. So we talk about, most people don't have back problems. They have back solutions. So their backs are incredibly strong, but their abs and their ass are weak. So as a result, your strongest worker comes to work all the time. You watch someone with terrible deadlift technique. Well, it's usually because they're using their back as much as possible because their back is their strength. Now, that's your load and fatigue capacity. Yes, they are underperforming their hip strength. Well, that's your glutes. They don't understand how to brace. They don't have to use their lats, but they can heave with a very poor position just using their back. So, yeah, the weakness there is glutes and abs. If we then teach how to use that with that fantastically strong back you've got, you're going to keep reaping great rewards. So, yes, I would say if we look at it, glutes and abs, I've yet to see anybody whose glutes and abs were too strong.
I agree with that. Now, number 3, is there such thing as bad form for executing an exercise?
Seriously, you didn't ask that question, did you? You couldn't ask. I mean, I'm sure that there's not a single Olympic lifting coach in the world who says to athletes, just lift like shit, you'll get there. Do you think that there's a golf player, tennis player? Shit, no. But the thing is, if you're a 150 centimetre female who weighs 45 kilograms and you're deadlifting, you will use a different technique than the person who's 2 meters tall and weighs 200 kilograms. but each of you have a best technique for yourself. Well, your coach will have to understand how to get that for you. So every individual has a best for themselves. And
Okay.
Skill acquisition. If you learn shit technique, you will have shit technique. Now, here's a thought of playing baseball, right? I play baseball, and often I would be playing at people would be throwing balls, we would say 95 to 100 miles an hour, over 60 feet and 6 inches. Now, I've got a bat that I'm going to try and hit that ball correctly with. That ball's, by the time that's out of that pitcher's hand, how did my body possibly get that swing right to connect with it? Because that ball's moving too fast for me to make adjustments with. Apparently, it's only over the first 6 feet of the actual throw that you can make your adjustments with. That's because technically I would have hit 1,000 balls a day, and with perfect technique. That's what we do. You practice perfect technique consistently, and it comes absolutely at your command faster than thought will give you. You have to be able to react without thinking. If you have to think all the time about, in our sports, you're not going to move.
Yeah. Now,
practice creates perfection.
Is there such thing as safer exercise for low back pain? True or false? Or yes or no?
Absolutely. There is safer ways to perform. And it can be, remember, we have some people who have different body types. So a good coach has to be able to attend to finding out what is your personal best technique. It doesn't happen naturally, because most of my work with high-level athletes are people who got hurt weight training for their sport, and they all say, I wish someone had shown me how to coach and move correctly to start with. Now I've got injured using shit technique, and it's impeded my career. I wish someone had taught me how to move correctly and lift correctly in high school.
Yeah.
That's super important. There is no excuse for bad technique.
Yeah, I agree with that.
It never transfers to performance.
When you hear this sort of a statement, you should train around the pain and not through the pain. True or false?
Essentially, we'll say it's true. You should not be creating pain from a biological point of view within that lift, because that means something is still not correct. So we have to find out, how do we get you to move without that experience of pain in the movement pattern you're desiring. So if you're hurting doing it, and of course that's always evaluated into regard of you have the injury or not, it's discomfort's different to pain. There's a lot of little variables there we'll work with, which is often people say, I will have pain. I'll say, are we saying you really have pain, or do you have discomfort? Discomfort means it's uncomfortable, but it's not actually something that's threatening to you. So that's pretty important, is to actually be able to differentiate the difference between discomfort and pain. And a lot of people don't understand the difference of, it's tough, but that's not pain. Pain tends to be the thing which is uncontrolled.
Okay.
So yeah, it's uncomfortable. That's the thing.
Should you be worried if your knees crack? When should you worry?
Well, if they've never cracked in the past and they start to crack more consistently, I'd get it checked out. If they consistently cracked on and off over the years, then it tends not to be a sign that there is an issue. It's tended not to be shown to be an outcome we need to worry about too much about, but have your foreman assess the technique, and we may find that there is something there that does change it.
Okay. If they regularly just crack, but there is no pain, it is usually something that is probably normal on the actual joint. Or do you think there might be some degeneration around the cartilages? I don't know. You're the experts. What is happening?
Well, that's the thing, is where I will assess it, is just to say, show me when you experience it, show me when it occurs, and then we might do some exercise to see if it changes that thing. And if it does, we go, yeah, that click actually wasn't necessary to be there. You have a weakness of a particular movement pattern, and here's your correction, and it will stop clicking. There are times, I think, where sometimes we might add more muscle mass, we might change our body subtly, and the body has to accommodate to that as well. I mean, it used to be my feet always cracked and my ankles always cracked. Yeah, but they stopped as I did more squats. So it's not a sign that particularly you've got an injury.
I forgot to ask you in the under overrated. Now that I have it in my head, what is your stance, or do you think using your belt, like lifting belts, do you think, are they overrated or underrated?
A touch overrated. We do tend to see them as a fashion accessory by some individuals. There's one guy I used to wear his down the beach, he thought it looked pretty cool. So they are a performance tool once again. So they are used at certain times, and if you're a performance athlete, you may put them on from the start of your warm-up onwards, because it's part of your performance technique that you are going to practice the way that you're going to perform. So for some people, I don't have a problem if you've got an empty bar and you put your belt on, because you're going to do your heaviest weight that way. Other people, we might see them more comfortable put it on at 80% of max. There's individual characteristics there. For example, playing baseball as I did, we would often have the catchers wearing their catching gear when they were running on the bases to get used to performing the way that they are going to be on the field with. So there are variances within it. Overall, a lot of people just wear the belt because I think it helps their backs, and really it's not. It's a tool that you got to learn how to use like anything else.
If it gives you more confidence, perhaps you feel like more safer, quote unquote safer,
Yep.
Do you think it is still sort of fair to use it, or is it something that you should?
That's a wonderful reason to use it. If it improves your confidence to perform the movement, then I think keep using it, but don't max out if that's what you need to do for that. What you're going to do is you're going to learn to become comfortable with the movement, and then you'll probably take the belt off and find you're comfortable without it again, because now you feel good with the movement. Use it for the tool that it is. And there's our biopsychosocial. Does it make you feel better? Do you like that? Okay, I've got no problem with you using it then.
What about knee sleeves? Same thing?
Same thing, absolutely. I tend to wear them all the time, that and wraps. I like them. I mean, Sebastian always laughs at the sort of wraps I use because they're soft and they're useless. But they give me a little bit of feedback kinesthetically that, hey, I like. Are they help my performance? No, only mentally, but that's all I need. So knee sleeves and wraps, they have their place. It's what you're comfortable with. I often have people who say they have a problem with squatting, so I put some wraps on them and sleeves, and they go, oh, I don't have a problem squatting. That's nice. It's now got you that little bit of something you needed to do that made you feel better. And now after a few months, you might take them off, and you're probably happy.
That's awesome. Okay, we're going to go through last part, and I let you go.
Go for it.
How are you going with time?
Whatever you need, Astrid.
Okay, so this one is this or that. Okay,
Yep.
So I give you some two options, and or more than two options, and you kind of choose maybe which one is the best answer, or it depends.
Yeah.
All right. The first one is, when you have back pain, should you rest or take anti-inflammatories or foam roll it or trigger point it or let it be?
None of those. Yes, you got to learn. I think if we said any back pain, it really is anti-inflammatories have their place for the right inflammatory problem. But if you haven't got an inflammatory problem, you don't need anti-inflammatories. Foam rolling, well, what are you foam rolling? If it makes you feel better, okay. There's a lot to each intervention, this or that, really. One of the things I'm encouraging is find the positions and postures that don't give you pain and start to work with those. And then get in to see a good professional who can assist with giving you the next direction.
Sounds good.
Yeah.
Now, second one. If you had to pick 1, 2, 3 exercises for training your glutes most effectively, which ones would you choose?
Well, it's actually, I think the best glute building little routine I've ever seen, and one I really, really love, is I love hip thrust followed by sumo deadlift as a superset. All right,
okay.
There's two beautiful movements that you superset those a couple of times a week, and there's your hypertrophy. Now, I've got two exercises there because hip thrust puts you into the wonderful position where you're loaded maximally in the most biologically and evolutionary position for a hip, glute max. 0 degrees from shoulder to hip to knee, you're now into it, great. So that's the hip thrust, the most wonderful thing. Brett Contreras' work there was stunning, and we can all be great and thankful for his wonderful work that he's given us all there. So, superb work. Sumo deadlift, similar sort of experience. We are going into a high position generally, and we're going to be using abduction and external rotation, which is the other component apart from hip extension. And then let's do the third one, squats, because squats are going to work you in that position where you don't get as much from the sumo and the hip thrust. So you can almost see you're going from hip thrust where you're at 0 degrees, the sumo a little bit higher, and then you go squat a little bit deeper. Perfect. They're your 3 best exercises ever.
When you refer to the squats, do you have a preference in the terms of how you perform it, like whether it's high bar, low bar, front squats? Which one are you referring to? Or is there any difference?
It will tend not to be front squat because that will tend to be more quad dominant.
Yep.
So if we're looking at a squat, we'll tend to be high bar to
bar.
low bar where you're feeling comfortable with that squat. What's your body well?
Okay, so that would be hip thrust, sumo deadlift, and back squat.
Beautiful. There you go. 3 best things.
Awesome.
You will absolutely grow an ass with those.
All right.
And you'll be a powerful athlete.
And if we were to say for rehab, would you still choose the same ones?
We tend to say you have to earn the right to get to them. So yes, any of those movements may be challenging and too high a level, and we may have to break up components. So think of glutes in three things: extension, abduction, and external rotation. And sometimes we have to do them lying flat on the ground on your back with a band across gravity. Low load across gravity to actually get you to perform. So with glutes, yes, those movements are great, but sometimes you haven't earned the right to use them yet. You got to get there.
All right. Should you fear a bulging disc? Are you fucked if that happens?
There's not many things in life to fear for me except spiders. Absolutely not, no. What we've got to do is there's clear understanding that a disc bulge does not predict that you will have pain. But if you have an MRI, and it can give us further information as to why you may have been having ongoing problems by perhaps even examining the muscle in there. So often in the MRI report, it might say disc bulge, but it hasn't commented upon perhaps how the muscle is in the area. And we do know that that can be predictive of dysfunction. So a disc bulge in itself does not predict an outcome. So don't be scared of it. And when we are solving, if you have the famous L5S1 disc bulge, right? Do I have to actually do anything particularly to that L5S1 in my mind? No, I actually have to create a movement pattern that's stabilizing the area for the human being. So 4-5, 5-1, realistically, in the work I'm going to be doing, I'm not going to be focused on that particular spot, that structure. Now, as a manual therapist, which I've done my postgraduate work in, I have occasionally worked more that way. But if I need manual therapy, I will actually refer out to manual therapists rather than what I would do, because I tend to see the more chronic, ongoing problem. So don't fear a disc bulge. There's lots of things we do with them. You can perform spectacularly well. I've had world champion athletes with disc bulges come and see me, and they got to perform. I had a top-level golfer one day came in and he fell on the couch. All he could do was turn his head. He just said, "I'm playing golf tomorrow." This is a guy who had a most spectacular back injury at that point. Now, seriously, he was a step away from hospital. But his words were, "I'm playing golf tomorrow. It's worth a lot of money." All right, he wasn't negotiating. So he got out there, and good news is he actually won his match play. How did he do it? Well, because he was injured, he had to play conservatively, and his opponent tried to intimidate him. Opponent made the mistakes. There you are, gift of injury. So don't fear it. Sometimes you win a lot of money with it.
All right, awesome. Last 2 questions. Is there any supplements you recommend or use during during injury prevention or rehab?
Well, I think sometimes it's a bit like insurance. I use glucosamine, chondroitin, and MSM twice a day, probably double the normal dosages, and have been doing that for about 15 years. Now, I move very well. Could I prove that that's the reason I move well? No. But it's like paying my insurance. Is it the reason I'm moving well? Quite possibly. There is some good indication that if you take hydrolyzed collagen, that has a good effect upon tendon repair. Okay, there are ways we use that. So I tend to use hydrolyzed collagen as well. About 30 to 60 grams every single day. Combined with vitamin C, I believe they work together.
Awesome. And the last one is, have you ever changed your mind or stance over something pertaining glute training, rehab, back injury over the years?
I'm sure I have. I'm sure I change my mind slightly on something every single day. It's a challenge to it. It's sort of like, realistically, I don't find that there's a particular topic that I'd almost look at and say that there's a hard and fast rule, except for the one about bad technique. That's just blatantly stupid, and that's just where people get this idea that you can get away with dumb technique. It flies in the face of every single art and performance, painting, music, athletics, sport. There is nothing in the world that good technique doesn't matter to. So let's just get rid of that. There's not a great performer, there's not a great coach in the world who deals with top-level athletes in any single sport, art, music, anything in the world, who says technique doesn't matter. Not a single one. Only shit coaches. Only people who do not have success, who want to embrace mediocrity, will say the technique doesn't matter. It validates why you're a shit at a coach.
Yep. All right. So I am so grateful, Andrew, for you to be here. It was all such an amazing interview and discussion. What are some of the future projects you have? I know you have the grad projects coming, and you've been cooking that for a while. So what else is coming for you?
Well, the grad project is Lisa and Ben and myself are putting together another lecture on, I think it's Thursday the 18th of this month. So we're going to do a little bit more advanced back rehab solutions. So we'll be demonstrating some of the things that we applied after we discussed some of the mechanisms of back injury. And then, well, Danny Antonellis, Dr. Danny and myself running United Health Education. We cannot wait to get out of the gate and get our workshops running on all the wonderful things, our foundations, our glute workshops. We are looking so forward to getting back out with those. We've updated that. This is what lockdown's done. And Sebastian Oro and myself, the Australian strength coach, well, we've done a lot of work in the last couple of years, have updated our workshops. So we've almost now created a pro level new one as well. So there's so much we are looking forward to bringing out. Probably the best work there's ever been at the moment. So I cannot wait to get out and help with all the education. They're all great people to work with, great professionals.
You're amazing. You're amazing. Such a powerful and amazing interview. Thank you so much for your time, Andrew.
Totally a pleasure, Astrid. Always lovely to catch up with people who are passionate like ourselves. It's a great industry we exist in, isn't it, huh?
It was awesome.
Have a great day out there. Train well.
Bye-bye.
See everyone. I always say, if you're not going to do anything, but you're going to do something, and you call it Pilates, well, I'm happy you're moving. Good. You've got to let people do the thing they're going to do, not tell them to do something they're not going to do. There may be something of greater benefit, but if they're not going to do it, welcome to the psychosocial world. You're not going to get them benefit if they're not going to do it. But I want them to
agree,
move
100%.